everyone, and welcome back to Medigap Show, your go-to source for everything Medicare. I'm Holly Cohen, licensed agent, your host, and today we're shining a big spotlight on a video that you absolutely need to see. It's featuring Congresswoman Katie Porter and healthcare whistleblower Wendell Potter. This is a discussion that affects us all, so stay tuned and get ready to be informed. Before we dive into the details, my purpose for our channel is for not my generation. I'm about 12 years away from Medicare age. It's my children who are in their 20s to make sure that our public understands what is happening in the world of Medicare and hopefully keep original Medicare around for our future generations. In this video, Congresswoman Katie Porter and Wendell Potter delve into the challenges and potential changes facing Medicare. They discuss crucial aspects that affect all of us, shedding light on the complexities of our healthcare system, and especially Medicare. It's a conversation that demands your attention, so please don't miss out. But before we get started, I'm asking for your support. Please hit that subscribe button and give this video a thumbs up. By doing so, you're not only staying connected with us, but you're also helping us spread essential information. Now, let's jump right into the details of this enlightening video.
Hi, I'm Congresswoman Katie Porter, and today I have with me Wendell Potter. He has been a leader in being willing to talk about how health insurance companies are wronging those who seek coverage, and he knows it from the inside, having himself worked for a big health insurer. So what we wanted to do today is thank you for being here and ask if we could talk a little bit about Medicare Advantage.
Absolutely. I appreciate the opportunity. I used to work for Humana and Cigna, both big insurance companies, both involved in Medicare Advantage. So I saw up close exactly how these companies and other companies are really ripping off taxpayers and cheating a lot of Americans out of the care that they need.
Let's talk about what's actually the differences between them and how people might understand what the costs and choices and disadvantages are between traditional Medicare and Medicare Advantage, because they are very, very different, despite sharing that confusing name of Medicare.
In a Medicare Advantage plan, what you are doing when you're enrolling that is enrolling in a private plan with all the problems of private health insurance. That's not even known in the traditional Medicare program. You have to jump through all kinds of hoops to get the care you need in many cases.
So traditional Medicare is your government. You pay in and government reimburses your provider.
That's right.
Correct?
Yeah.
Okay. So there's no profit motive in that. You've paid in, the government has the Medicare dollars. When you get sick, you go to the doctor, you get treatment, Medicare pays. Medicare Advantage, let me ask you the most basic question. Why would a huge health insurance company, let's use United Healthcare, why would they offer Medicare Advantage plans?
A lot of profits. It's become their biggest cash cow in many cases. They get even more money from the Medicare Advantage program than they do from the commercial health insurance plans because...
No, wait, you're saying Medicare Advantage is even more profitable than traditional health insurance?
Oh, absolutely. Oh, yes, for sure. It's a lot more profitable because they figured out how to rig the system, how to try to convince the government that the people who enrolled in their plans are sicker than they really are, and the government pays them more because of that. They've been paid billions and billions of dollars more every year than they're entitled to.
And you don't have to take just Wendell's word for this. This has been front page news on the New York Times, on the Wall Street Journal. Virtually every paper has said this is happening to the tunes of billions and billions of dollars. All right, let's talk about administrative expenses. Traditional Medicare spends about 1.3% of its money on administration. So think about processing the claims and the cutting the checks or resending the deposits. What does Medicare Advantage spend in terms of administrative costs?
Oh, it's far more than that. It's about 17%. And a lot of that includes profits and pay to the big CEOs, the CEOs of these big companies and their top executives.
And in a hearing that we had about Medicare, I actually demonstrated this using dollar bills. So if I pay my insurance company $100, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, $17 go to administrative costs. Okay, now Medicare Advantage is very quick to tout its benefits. And it's true, there are some things that Medicare Advantage can provide that traditional Medicare doesn't, that people need to look at the whole picture. So let's talk about this when it comes to prescription drugs. For traditional Medicare, is it right? Is it alphabet soup here of Medicare? But I need to go get something called Part D. Is that correct?
That's right. Part D, you have to buy separately if you have Medicare, and that's an expense. It is. Medicare Advantage plans do incorporate a prescription drug benefit.
So it's included.
So let me just interject quickly on what was just said. Part D, the premium, which used to be $18, then it went down to $11, then it went down to $5. Now it's at $0 for some plans for Part D. Now, that's the monthly premium that they are discussing right here. That is inside a Medicare Advantage plan, bundled inside, which means you don't pay the premium when you're on Medicare Advantage for a prescription Part D drug plan. But when you go to pick up your prescriptions at the pharmacy itself, you're still going to have basically the same copays as you would on a standalone Part D drug plan if you're on original Medicare. And as I just said, one company actually went down to a $0 premium for 2024, which has never been done. So just want to clarify that one little point in here, and let's continue our video.
Here. So the big ones that I think I hear about and I fought to try to expand traditional Medicare to cover are vision, dental, and hearing.
Very important.
Does every Medicare, some Medicare Advantage plans include those things? Do they all include all of it? How good is that coverage?
You have to check because it's hard to determine exactly how valuable those benefits are. And not all of them offer those extra benefits. Most of them do. But you might find that in many cases they're just discounts or not very good coverage, and that's particularly true for dental insurance. You are going to be likely paying a lot out of your own pockets. They advertise them heavily, as you mentioned, because that's a big selling point that seniors should know that in many cases those benefits are very paltry.
And so like I could have a very high copay or have very limited, so maybe I have dental, but it only covers a couple $100
That's right.
worth of services, and I would still be winding up out of pocket.
Yeah.
Okay, so it's again, I think, really important when you're dealing with Medicare Advantage to remember you're dealing with a private health insurance company. So you should approach advertisements, you should approach their pitch with the same skepticism you would use when you're buying a used car, which is to read the fine print, really assess the claims that are being made.
Exactly.
If the government tells you that something is included, it doesn't have any incentive because there's no profit motive to mislead you on it.
You're right. And I think we're getting down in the category here of the things they don't tell you about in those advertisements.
And these are big, and these are really personal to me. My dad has a rare form of cancer, and his oncologist, my dad is over 65, and he got a Medicare Advantage plan. He didn't ask me. He got what I call Medicare Disadvantage. And when he got this rare form of cancer, his oncologist within his limited network, which is what comes with Medicare Advantage, is a limited network, his oncologist had never treated this form of cancer.
So for just one moment, let's talk about what Katie Porter just said about cancer. So Mayo Clinic. Mayo Clinic and many of the large hospitals in the country that treat cancer will not accept a Medicare Advantage plan. You would be out of network on your Advantage plan for Mayo Clinic. So you could have a PPO and be out of network, but it doesn't even mean when you're on a PPO that the facility or the doctor has to treat you if you're out of network, even if you're on a PPO. So Mayo Clinic does not accept Medicare Advantage plans. So let's get back to listening to the Congresswoman and Wendell Potter now.
What comes with Medicare Advantage is a limited network. His oncologist had never treated this form of cancer. So I wanted my dad. We live really my dad lives in Iowa. It's close to Mayo Clinic. It's close to the University of Iowa. These world-class facilities have oncologists who treated his cancer, but he couldn't go.
My mom did the same thing. She enrolled in a Medicare Advantage plan. She broke her hip, needed to have skilled nursing care and rehab. The network was so bad that we disenrolled her, and she got back in traditional Medicare. which I know saved her life. That happens a lot. When you get older, you'll find in many cases that the facilities and the doctors you need are just not in network. And I think people, frankly, are dying or increasingly getting out of Medicare Advantage, going into traditional Medicare in their later years, and that's costing taxpayers even more because they're going back into traditional Medicare, and these private insurers are off the hook for the rest of their care.
Talk more about this, because with Medicare Advantage, if I want to walk in and see a specialist, can I do that?
Medicare Advantage, not necessarily. You might need to have a referral. It depends on the type of plan you had. Talk about alphabet soup. You can have an HMO or a PPO, and you really have to read the fine print to know whether you'll have to have a referral or not. Chances are you will, and you'll find that in many cases, the doctor or hospital you need or want to go to is not in network or might not be next year.
Yeah, I think one of the important things for people to remember about traditional Medicare is there is no private insurance plan, whether it's through employers, for people who are working, or through Medicare Advantage. There is no private insurance that has the breadth of providers and the choice of traditional Medicare. So that's a very important thing that you have to think through, as particularly if you live in a rural area, if you live in an area with more limited networks. So I think the point of this program is buyer beware. Understand that they're selling you something and they're getting rich doing it. They have an incentive to push the benefits and hide the restrictions, and I think Congress needs to be doing more to both reform this program, Medicare Advantage, or to eliminate it, and to make the advertising of it more clear. So one of my colleagues has a bill that would not allow private insurance companies to market these plans as Medicare because it's confusing to people. We've also had conversations about trying to expand traditional Medicare. So things like the vet dental or the vision are not pushing people to have to choose between being able to get the health care they need for their body or the care that they need for their eyes or vision or hearing.
Congresswoman, you have just introduced a bill that will address some of the problems with the Medicare Advantage program. Can you explain what the bill does and why you introduced it?
Yes, the bill is called the Medicare Advantage Consumer Protection and Transparency Act, and that's a mouthful. But what it does is really simple. It gives data to the government, requires these private companies that are offering Medicare Advantage to give data to the government so that we can figure out if they're actually following the rules of Medicare, or if they're overcharging taxpayers and if they're shorting seniors on care. We talked about how Medicare Advantage requires you to stay in network. We don't know how big these networks are. This bill would give data to government so we can see how serious those problems are. It would also increase penalties for Medicare Advantage plans that are cheating patients.
Thank you.
This has been ongoing for a number of years, and we need to put a stop to it, and that starts with having the stronger teeth in the enforcement piece. I asked the director of the Center for Medicare and Medicaid Services what data there is, what evidence there is that Medicare Advantage either costs taxpayers less or improves outcomes for patients. I mean, I'm willing to take either or. I think we should be aiming for both. But I asked her to tell me about that data. And do you know what she said? None. There's none. There's no data. And there's actually a lot of data pointing the other direction, that Medicare Advantage actually costs us more and produces worse patient outcomes. So I guess I really struggle, Wendell, and I think I know the answer to this, but as someone who's worked for a big insurance company and dealt a lot with Congress, why on earth does the government continue to have Medicare Advantage, to continue to expand or tweak it when it isn't making care either cheaper or better?
The reason is because they're able to spend so much money on lobbyists, on advertising. Just last year, they spent millions of dollars, largely here in Washington, D.C., trying to scare lawmakers away from even reducing some of the overcharges. And the money that you could save from these overpayments, getting rid of some of this excess administrative expense, you could easily improve to traditional Medicare. You could add dental, vision, and hearing. You could do a lot.
That's what's most galling about it. I want to emphasize that is that We have the dollars in this system to deliver the benefits of Medicare Advantage within traditional Medicare if we cut that profit motive out, if we stop putting private health insurance companies in charge of our Medicare system. So let me close. If I'm watching this, or I signed up for Medicare Advantage, late night TV ads got to me, and now I'm running into problems. I can't go see the nurses or the doctors I want to see. I thought I would get my drugs covered, but they're not covered. Can people switch?
You can switch, but beware, because you can switch, but when you're first eligible for Medicare, you can enroll in a supplemental plan without underwriting. In other words, you can be guaranteed to get an affordable, for most people, supplemental policy. If you enroll in Medicare Advantage and then want to switch back, you might not be able to get one that you can afford, because then you'll be subject to underwriting. They may charge you more than you can possibly afford. So there's danger there.
Yeah, so I would just say to people, you're talking to two people here who know a lot about this and are pretty passionate about why traditional Medicare is the right choice for most seniors, but you're also talking to two people whose parents enrolled in Medicare Advantage. So I think it's really important that if you know someone who's approaching that age, I'm 49, it feels a long ways away, but I'm really working to educate myself to make those good decisions. So thank you very much for being part of the conversation, Wendell. It's always such a pleasure.
Thank you, Congresswoman.
The privatization of Medicare and the discussion around Medicare Advantage are central themes in this video. These are topics that will be on everyone's minds this election year. You're going to hear the term the privatization of Medicare many times, most likely this election year, because we usually hear it every election year. What the privatization of Medicare means, what that term means, is Medicare Advantage. It means giving up original Medicare to an insurance company to completely manage your health care and your Medicare. Stay tuned for more insightful episodes right here on the Medigap Show. Click on the link in the description below to watch the full video. And of course, don't forget to subscribe and hit that like button. Until next time, I'm Holly Cohen, and as always, please be well.